So we want to look at the 4P's. All right, I actually left 1P out, and this is what is known as a psyche. So they talk about the powers, that's how the uterus is contracting. They talk about the passage, that's the birth canal that the fetus has to pass through. They talk about the passenger. So they actually call them the 4P's in obstetrics. Okay, so but most people usually put out the psyche aspect. Okay, but the psyche aspect is also a thing there. Okay, these are the components of the birth process. Okay, so you can say 3P's or 4P's. They are essential elements that determine how labor should go on smoothly. So powers is the uterine contraction. So the uterine contractions, are they frequent? How long are they coming in? How intense are they? Secondary, okay, that's the primary power. Secondary powers, this is when the maternal pushing efforts is what is now making it. Primary powers is just coming in naturally, controlled by hormones like oxytocin and prostaglandin. Secondary powers, the mother has to come in active pushing. So passage, which is the birth canal. Now talking about the bony pelvis, so the shape and the size, okay, of the bony pelvis. Okay, also the soft tissues there. Okay, so soft tissues, the cervix, the vagina, the perineum. Okay, then the cervix must keep becoming thin and becoming dilated, okay, for the baby to be able to pass through. So when you talk about the passenger, you're talking about the fetus. What's the size and position of the baby? Okay, what's the baby's attitude? Okay, that's how is the baby lying? Okay, so molding to, that's the fetal skull bones, they shift slightly to adapt to the birth canal. Okay, so that's also what for the 4P's. Then the psyche, of course, is how the mother is feeling through the process. Okay, so the 4P's of the birth process.